Hi, my name is Megan.
Hello.
I'm a student nurse practitioner. We're going to be doing a 30-minute head-to-toe exam today, so I'm going to kind of walk you through the different parts of the body, and if there's anything that feels uncomfortable or that you don't feel comfortable with, just let me know.
Understood, thank you.
Okay, so I've performed hand hygiene already, and the vital signs have been performed, which were all within normal limits. And the Snellen eye chart has also been performed to test his visual acuity, which tests cranial nerve number 2, the optic. And also as we start recording, I just want to get a verbal consent that you're okay with being on video.
Yes.
Okay. So can you please tell me your full name?
Yep, first name's Peter, last name is McAuliffe.
And your date of birth?
Is May 21st, 1992.
Okay, and can you tell me where we are?
We are at a health clinic in Boston, Massachusetts.
Okay, and can you tell me who the president is?
Donald Trump.
And what month is it?
It is April.
Okay, so patient is alert to person, place, and time. So I'm just going to start this exam in your head. So I'm going to start by looking at your scalp. Just checking for any nevi, any sort of abnormalities, any rashes or lesions. Have you had any discomfort there?
No.
Okay, I'm just going to palpate here your temporal arteries, and that feels good.
Yep.
Okay, I'm also going to listen to your carotid pulses. You can, whatever you feel comfortable with as far as your eyes open or closed. I'll let you know if I need you to close them though. So I'm going to auscultate the carotid on both sides bilaterally, and then I'm also going to be checking them bilaterally to feel that they're both equal and strong. Next I'm going to palpate your lymph nodes, so the pre-auricular here, and I'm going to be doing 2 to 3 circular motions with that, but for the sake of time I'm going to go through it quickly. The post-auricular, the tonsillar, the submandibular, the submental, the tonsillar, the clavicular, and the deep cervical in the back there. Okay, and then I'm going to have you tilt your head back. I'm examining the trachea here. I want to make sure that there's no asymmetry. Everything looks good. I don't see any deviations. I'm also going to be palpating the thyroid. I'm going to palpate on both sides, check for any nodularity or any swelling. And then I'm also going to have you swallow. Okay, and so I'm also assessing it and swallowing, and I don't feel any irregularities either there. Okay, so next I am going to assess your eyes. So I'm just going to, and I would do all of my examinations on both sides. But for the sake of this, I'm just going to be performing it on one side. So you're going to feel my hand on your upper eyelid. I'm going to have you look down, and I'm just looking at the different structures of the eye, and then underneath, and you're going to look up. Beautiful. Okay, and again, we've already done the visual acuity test. Now I'm going to do what's called an H test. We're going to be testing for cranial nerves number 3, 4, and 6, which are the ocular motor, the trochlear, and the abducens respectively. Okay, so you're going to look at me and look at my finger, and you're going to follow my finger without, I'm trying to make sure I'm not covering the camera, without moving your head. Okay. All right, and that looks good. Okay, and then next I'm going to use my pen light, which I don't have. But I am going to be using this as a pen light. I'm going to be, of course the lights would be down for this, but I'm going to be shining the light into his eye, and I'm going to be looking to see that his pupils are equal, round, and reactive and accommodating to light, which they are. Next I'm going to use the ophthalmoscope, and I want to check the different structures, the posterior structures of the eye. This also does not work. So for the sake of this, I'm just going to be looking at it. But I would have the lights down, I'd have the light on, and I'd be looking for the red reflex and then looking at the posterior structures within the eye. And the red reflex would help me find that. All right. And then we're going to do a cover and uncover test. So you're going to cover one eye. So I'll do it the same side as you. Okay, and then I'm gonna have you put your hand down, and there I'm looking for any sort of deviations or to see if his eyes had deviated anyway. Now I'm gonna have you cover it again. Okay, and then you're gonna tell me how many fingers I'm holding up.
2.
Okay. Can you see it?
No.
Oh, what about here?
1.
Okay, and then again, you're gonna keep that and let me know when you can see my fingers coming through.
Yeah. Yeah.
Okay.
Yeah. Yeah.
Don't turn your head, but yes. Okay. All right, you can put that hand down. Let's see, now I'll move on to your ears. So first I'm just examining, I'm gonna pull the pin up forward, I'm examining the external ear, and again, I'd be performing this on both sides. And then I'm also gonna use this opportunity to look inside the ear. And so I would be pulling the pin back, and I'm gonna look inside again. This does not work. And I'm looking at the tympanic membranes and the inner ear, the ear canals, to look for any abnormal discharge or redness, something that would signify a red flag for us. Have you had any pain or anything like that?
Nope.
Okay, good. So now I will be looking at your nose and palpating your sinuses. So first, actually, before I move on, I'm going to test his cranial nerve number 8, which is the auditory. So I'm going to have you close your eyes. Okay. Can you hear that?
Yeah.
What about on this side?
Yeah.
Does it feel equal on both sides?
It does.
Okay. And then I'm also going to use a tuning fork for the purposes of this. This is a tuning fork. So I'm going to first put this on top of your head for the Weber test. And do you feel vibrations equally on both sides?
Yeah.
All right. And then the Rin test, do you hear that on this side?
Yeah.
And then do you hear it on this side?
Yeah.
And then I'm going to put it on the mastoid bone here. Do you feel vibration?
Yeah.
And then on the opposite side as well, feel vibrations. Feels equally on both sides.
Yeah.
Okay. Now I'm going to move on to the sinuses. So I'm going to palpate your frontal sinuses here. Do you have any pain or tenderness?
No.
Any pain or tenderness here?
No.
Okay, good. I'm going to have you cover one nostril. Breathe in and out. Okay, and then do it on the opposite side. Any difficulties breathing there? I know you've had a few broken
Not
noses.
more than usual.
Okay, nothing abnormal from baseline.
No.
Okay, and then I'm going to have you close your eyes. And normally I would have like an alcohol swab or something like this. I'm going to ask him to take a sniff. So can you smell that underneath?
Yeah.
What does it smell like?
Alcohol.
Yes. Okay, I'm going to have you tilt your head back, and I'm going to use a clean otoscope here or a pen light to be able to look into the sinuses, and then I'm looking at any sort of abnormalities or deviations, anything red or angry looking. All right, and then moving on to the mouth. I'm just looking at his lips. They're appropriately moist. They're appropriate color. I'm going to have you open your mouth, and I'm just examining. I would also use a tongue depressor, which we don't have. This will be my tongue depressor that I'm not going to put in his mouth. And I'm looking at the gums, the teeth, the tongue. Make sure that there's no asymmetry. There's no, lesions inside the mouth. Can you say ah for me? Perfect. And that's testing the cranial nerves numbers 9 and 10, which are the glossopharyngeal and the vagus. And then can you stick your tongue out for me? Move it side to side. Perfect. And that's cranial nerve number 12, which is the hypoglossal. Can you show me your teeth? Can you raise your eyebrows for me? Perfect. And that's testing cranial nerve number 7, which is the facial nerve. And then I am going to have you clench your jaw like you're smiling. Smile for me. Perfect. And that's testing cranial nerve number 5. And that is the trigeminal. I'm going to have you shrug your shoulders for me. Perfect. And then you're going to turn your head against my hand to the resistance. Perfect. And then the other side. perfect. And that's cranial nerve number 11, which is the spinal accessory. So everything looks good from there.
Perfect.
I'm going to move on to any pain when I was doing any of that, any discomfort. I didn't appreciate anything abnormal.
Nope.
Okay, make sure we're still recording. Good. I'm going to have you turn all the way around, okay, so that I can assess your lungs. All right, so normally I would expose your back here. We're gonna pretend like you have a nice open back and we can see, but I am looking for any sort of abnormalities, any retractions, any lesions, any asymmetry, which I'm not seeing. And next I am just going to do a diaphragmatic, or check for his thoracic expansion. So I'm gonna feel underneath the ribs here. If you could take a deep breath in. Perfect, and out, and that's equal bilaterally. And then now I'll test for tactile fremitus. So every time you feel my hands moving like this, I'm gonna have you say 99, okay?
Okay. 99, 99, 99, 99.
Okay, perfect. And that's checking for any sort of consolidations of the lungs. I didn't feel abnormal vibrations or anything like that. Now I will test your diaphragmatic excursion. I'm just going to do it on one side for the purposes of this exam. So I'm going to have you take a deep breath in, then you're going to exhale and you're just going to feel tapping on your back, okay? Okay, and then when I feel that dullness, I'm going to mark that place. And then I'm going to have you take a deep breath in and hold it. I'm going to palpate or percuss down. And when I hear that dullness again, you can take a deep breath or breathe normally. Then I would mark that and be able to measure the diaphragmatic excursion, the distance between those two measurements. Okay. Now I'm going to percuss the different lung sounds for the different lung fields. So you're just going to feel some tapping. Again, checking for any consolidations, any differences in asymmetry in the sound. Now I am going to listen to your heart sound. So every time you feel my stethoscope on your back, just like with the 99, I'm just going to have you take a deep breath in and out.
Yep.
All right. Good. Again. Last two. Perfect. Now I'm going to test for egophony. So every time you feel my stethoscope, you're going to say E. Okay.
Okay.
And I'm listening for the E to A change. If I do hear it, then I would be more concerned that there's some sort of abnormality there.
E, 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 E.
Okay, perfect. And I didn't hear any of that.
Perfect.
All right. So I'm going to have you turn around and face the same direction that you were facing before. Again, to complete my anterior assessment, I would also have him have his gown and be exposing the front of his chest, looking for any retractions, any labored breathing. I'm also looking for asymmetry and scarring. First, I'm going to percuss in the 4 different positions here. Okay. And I am going to listen to your lung sounds in the front of your chest as well. You take a deep breath in. All right, and again. Perfect, and again. And again. Okay, perfect. While he's facing this direction, as I'm about to begin my cardiac exam, I also can assess for jugular venous distension, which he does not have. So I'm not going to be measuring the JVP, but I would lean the head of the bed back 30 degrees to do that. Okay, so I'm looking at his skin, making sure it's appropriately warm, that he has adequate perfusion. I'm going to check his nails for any signs of clubbing or cyanosis, which you don't have, which is great. You're perfusing well. I'm going to check cap refill. For the purposes of this exam, I would check every fingernail on both hands, and then I'm also going to check in the toes to make sure he has adequate perfusion, which you do. Okay. So now I am going to listen to your heart sounds. All right, and I'm listening to, and you can just breathe normally through these. I'm listening for S1 and S2 in the aortic, and I would spend, a good amount of time listening to S1 and S2, but I am going to go quickly for the purposes of the exam. The pulmonic, Erb's point, the tricuspid, and the mitral. And then I'm just going to have you lean forward a little bit. I'm also going to listen to the mitral while he's leaning forward at the base, and you can sit back at the apex of the heart, because that'll tell me if there are any sort of mitral murmurs, or I'm listening for S3 and S4. And then while he's laying down, I would ask him to lay in the left lateral position to listen to the aortic valve at the base of the heart to know if there were any murmurs there as well. Okay, let's see. I am going to, and then I'm also here, if I had his chest exposed, I'd be looking for the PMI here, seeing if there's an observable pulse or feeling for a thrill or a heave there at the PMI as well. All right, so to finish my cardiac assessment, I'm gonna actually have you lay down. So you're gonna lay with your head facing up here. Any restrictions when you're laying down here?
Nope.
Okay, feel okay?
Yep.
All right, so here to finish my cardiac assessment, let me just make sure we're in the view here. And we are. I am going to be checking your pulses. So I'd be checking bilaterally on both sides for the purposes of this exam. I'm just going to do one side. I check the radial, the femoral, the popliteal behind the knee, the posterior tibialis, which is on the back side of the Achilles, and then the dorsalis pedis. I know you can't see his feet, but I would be holding there and make sure that the pulses are equal on both sides and that he's perfusing adequately. Okay, and now I am going to start my abdominal assessment. Okay, so again, we would be exposing the abdomen, checking for any abnormal contour, just taking a nice inspection, make sure that the coloring is appropriate, there's no abnormalities there. And first I am going to listen to his bowel sounds, and for each quadrant I would listen to 4 quadrants, and then I'm going to listen for 10 to 15 seconds for the purposes of this exam. Though I'm not going to listen for 10 to 15 seconds. Do you have any pain right now at baseline?
Nope.
Okay. All right, so I'm listening to your bowel sounds here in all 4 quadrants, and they are present, which is good. And then I'm also going to listen to the aortic, the renal, and the iliac arteries. I'm checking for any bruits or anything like that, which I don't hear. While he's laying on his back, I'm also going to palpate his inguinal lymph nodes, but I won't be exposing that area right now. So next I'm going to be percussing the abdomen, just checking for any sort of consolidation, and any pain with that.
Nope.
I don't appreciate any consolidation. I would palpate the spleen, so reaching over, I'm going to feel up and under the rib cage. Any pain with that?
Nope.
I don't feel any enlargement or hardness there. I would also do the liver span, so I'm going to percuss down, and I want to hear a dullness, and I'm going to percuss where the liver spans. So I percuss down from the nipple line on the mid-clavicular line, and then I'd mark that area, and then coming up from the umbilicus back, and I would measure that liver span to make sure there wasn't any enlargement. I would also palpate the liver, and then underneath the rib cage, I'd want to test for Murphy sign. Any pain with that?
Nope.
If you had pain with that, it might be suggestive of gallbladder. Have you had your gallbladder removed?
No.
Okay, perfect. A few other things I'd like to do is just assess you for appendicitis. Okay. So you're not having any pain at baseline right now?
Nope.
And you've had your appendix removed?
I have.
Yes, but theoretically, I'm going to test for it. The first thing I'm going to do is check for any sort of rebound tenderness. So I'm going to push down in your right lower quadrant. Any pain when I release?
Nope.
Okay. And then what about on this side?
Nope.
Okay, that's Rossing sign. I'd be looking for any sort of rebound tenderness on your side here on the right lower quadrant when you push down on the left. All right, and now I am going to check the psoas. So I'm going to push down on your knee. Can you lift this leg against resistance? Any pain in your abdomen when you do that?
Nope.
All right, good. And then I'm going to flex your knee up, and I'm going to hold here. Any pain with that?
Nope.
I'm going to internally rotate your knee, the obturator sign. Any pain with that?
Nope.
And then here I'm also checking for knee flexion and extension, which feels appropriate. I'm starting my musculoskeletal exam. Any pain with that? Any difficulties when I'm doing that?
Nope.
Okay. And then I'll do internal and external rotation of the knee. Again, I would repeat this on both sides, but for the purposes of this. And then while he's still laying down, I'm going to have you put your chin to your chest. And I'm not observing him pulling up his knees at all. You can put your head down, which would, we're checking for, that's Rudinsky's sign. We're checking for any signs of meningitis. No pain with that, shooting down your spine.
Nope.
Okay, and then I'm just going to lift your leg straight up in the air. I'm going to bend it first, and then I'm going to straighten this. Any pain shooting up your back?
Nope.
Okay. And that's Koenig's sign, which is negative in this case. Okay, so I will have you sit up. I believe I'm all done with laying down, but I'll ask you to lay down if anything comes to mind. Okay, all right. I think it might be easier if you're sitting in the position that I had you in before. Okay, so I'm gonna have you close your eyes and hold your arms out in front of you. Okay, straighten those elbows. And here I'm looking for pronator drift, seeing if he's dropping his arms at all, which you're not, which is great. And now I'm gonna test for so you can put those down and open your eyes. Now I'm gonna test for your strength. So I'm gonna have you put your elbows up to the side. I'm gonna push, maybe on that angle there. Push down. Any problems there?
Nope.
All right, you can open your eyes while we're doing this. So I'm gonna test your bicep strength. Okay, so I'm gonna hold here, and you're gonna pull back and against my arm. Okay, good. And then you're gonna push away now. Good, and that's a tricep as well. So good strength there. And then I'm gonna have you lift your knee up while I'm pushing down. Good. And then I'm gonna test here. You're gonna pull your foot back towards against me. Perfect, and push away. All right, and then push down like you're pushing on a gas pedal. Pull your toes up to your nose. Good. And I would test his strength on both sides, and you're very strong, so 5 out of 5 in all of the extremities. Okay, so next we will do, I'll have you stand up. All right, I'm gonna have you close your eyes, face that way. I'm gonna have you close your eyes, and I'm just gonna stand here, make sure that he's not falling. I don't wanna see any sort of, drifting any which way. Okay, perfect. Now I'm gonna have you walk away from me. I'm just looking at your gait. All right, and back to me. Good, everything looks normal. And then I'm gonna have you walk on your tiptoes there. And back towards me on your heels. Perfect. And then you're gonna walk heel to toe, going that direction. And back. So now, kind of wrapping things up, we'll do some sensations. So for sensations, I just want to see that you're feeling, and then I'll do some more mobility stuff. That you're feeling equal on both sides, but please tell me if not. So you're gonna close your eyes. This is what's gonna feel like. You're gonna feel it on your forehead. That's gonna be a dull or a light sensation, and this is gonna be sharp.
Yeah.
Okay. So you feel that?
Yeah.
You feel that?
Yeah.
Does it feel the same on both sides?
It does.
That.
Yeah.
That. Feel the same on both sides.
Yeah.
That. Feel the same on both sides.
Yeah.
Okay. And then I would make my way all the way down to his feet, make sure that his feet, he can feel that on both sides as well. I'm gonna go back and do it with the sharp object. Do you feel that?
Yeah.
Do you feel that?
Yeah.
Feel the same on both sides?
Yeah.
Feel that? Feel that?
Yeah.
No tingling or numbness or anything like that when I...
No.
Do you feel that? Feel that? Okay. And
Yes.
again, I would move all the way down. I would do this bilaterally as well. So now I'm going to keep having your eyes closed. If you could just tell me if it's a dull or sharp feeling.
Dull. Dull. Sharp.
Okay.
Sharp. It's probably sharp.
Yeah.
Dull.
Okay. All right. Perfect. All right. And keeping your eyes closed, I'm going to put an object in your hand. If you could just let me know what that feels like what you think that object might be.
Glasses.
Okay, great. And then we're going to test your, you can open your eyes. So we could do this on both the fingers and the toes, but I'm basically this is down and this is up. Okay, those feelings, and you're going to tell me whether it's down or up. You can close your eyes.
Down. Down. Up.
Okay. And then it's hard to see his feet on camera here, but I would do the same on the toes. So again, this is up and this is down.
Yeah.
Can you close your eyes and tell me which way I'm doing it?
Up. Down. Down. Up.
Okay. And then I'm going to have you set my tuning fork. Well, I'll use this. It was clean. I'm going to have you brush your heel all the way down your shin. Okay, any pain with that?
Nope.
And again, good. I'm going to use my tuning fork, okay? And I'm going to put this on your wrist. Any pain with that?
Nope.
Any electrical shock type of feeling? Okay, and I also do it on his big toe. Okay. All right, I'm also going to use a hammer to test your reflexes. We don't have a hammer, so this is going to have to do for the hammer. Okay, so the first one is going to be checking. So just relax your arm. And normally we'd see this like little jerking motion. And so I'd hit inside the elbow and we'd see a reaction here. And again, I would do this on both sides, but for the purposes of the exam, we're not going to. Dangle here. And we'd hit here, sorry. In the wrist, here, on the knee, here, thank you, and then on the Achilles, in the back. And then the last thing, I would have your foot come up. I'd be checking for any sort of pathological signs, so I'd be scraping up and around on the outside of the foot. I'd be looking for the toes to fan, just checking the Babinski, which would be negative in this case. Okay, let's see. Okay, now I am going to test your range of motion. So I'm going to have you bring your arms up and around behind your head and down and then behind your back. Good. Any pain with that?
Nope.
Okay, I'm going to have you slap like this. Any discomfort there?
Nope.
Okay, great. I'm going to have you put your hands up like a stop sign, extension, and then down, flexion. Good. Any problems with that?
Nope.
Okay, great. I am going to have you stand up again, facing that direction. I'm gonna have you lean forward and touch your nose, or try to touch your toes, sorry. Alright, and I would just palpate, and you can stand up, the vertebrae, make sure that nothing feels out of place, there's no abnormal curvature, any pain with that
Nope.
above baseline. Okay, and then using, with your hands on your hips, lean backwards, come towards me, any pain with that?
Nope.
Alright, and now side to side.
Hips.
Try to isolate your hips and just move the top part of your body. So don't move your hips, just move your shoulders. Okay, how does that feel?
Feels fine.
I'm also gonna palpate his AC. You can relax this arm. AC joint, make sure there's no like crepitus or anything like that. And then for your neck, I'm gonna have you look up to the ceiling and down chin to chest. And then I'm gonna have you turn all the way to the right and to the left. How does that feel?
Feels fine.
Okay. Touch your ear to your shoulder on the left side, and then on the right. Any pain with that?
Nope.
Okay. And then I'm going to have you sit down. I'm going to check your knuckles here. So I'm looking at the DIP, the PIP, the PIP, and the MCP knuckles, checking for any early signs of arthritis, which you don't have. Next, I'm going to do the Allen's test. So I'm going to cover his ulnar and radial. I'm going to have you pump your fist a few times, and I'm going to compress down, and then I'll release one at a time. Oops, you can stop. And then I'll release one at a time. I want to see that perfusion again. Okay. I will then do the Phelan's test. So you're going to do like an inverted prayer sign. Any pain, try to drop your elbows straight. Yes. Any pain, shooting sensations when you're doing that. And these are all tests to check for carpal tunnel.
Oh.
Not experiencing that. Okay. And then again, I repeat all of these on both sides. So tap, tap, tap. This is a Tinnell's test. Any shocking sensation?
No.
None of that. Okay. I am going to, there were two things that I just didn't check while you were laying down. So I'm going to have you lay down again. So something that I didn't do in the abdominal assessment that just came to me, which I ideally would have done, was the fluid wave test. So I would put my hand in the middle here and I'd kind of tap the side. I'd look for any sort of abnormalities, assessing for ascites or anything like that. And another thing is the bulge sign. Just make sure we're still recording here. The bulge sign on the knee. So I would swipe on the inner side of the knee and the outer side and see if there was any bulge there as well. So you can sit back up. Any questions, any discomfort after what we were doing?
No.
All right, well that wraps
Sounds great.
up today's
Thank
exam. I didn't notice anything, but we'll have you follow up soon.
Sounds great. Thank you.
Great.